with toenail fungus infection. So what a lot of people want to know is, where does the toenail fungus infection come from? Well, the infection, or the toenail fungus, of which there are many species that cause it, can be found in any environment. Every home, every workplace, every gym, every locker room, every salon, you name it. None of us are exempt from getting a toenail fungus, no matter what our lifestyle is, no matter what our hygiene practices are. But there are things that we can do to help prevent the issue. There are those that are more susceptible to toenail fungus infection. Those who have suppressed immune systems, diabetics tend to be more prone to developing the problem. But what it is that fungus, molds, yeast, and they're all related, like dark, moist, and warm areas. So when we have our feet inside of our shoes, that's the perfect environment for them. Our feet are in the dark shoes, where they're in them all day, may get a little sweaty. We may not have dried our feet completely, especially between the toes after bathing or showering. So after exposing our feet to this environment day in and day out, fungus is able to take hold. Now, if the person is immunocompromised, or if they have a nail injury, or if they have issues such as diabetes and poor circulation, which cause thicker nails and cause the toenail, the hard plate part, to loosen from the underlying skin, which we call the nail bed, that allows fungus and bacteria and other organisms to get in and set up shop. So that's where it comes from. So when we do see it in the office, there are a number of ways we go about approaching it. Number one, at least what I like to do, is to trim the toenails and send samples to the lab. One, to confirm that it is indeed a fungal infection, and two, for them to identify the species of fungus so I can choose the right medicine or the right path to go about treating this particular patient. I like to treat patients on an individual basis instead of giving everybody the exact same treatment. Everybody comes in with different issues rather, and so we have to tailor the program or the treatment plan to help this patient eradicate the problem. Another issue that we see, or another question that a lot of the viewers have asked over the year, is the issue of caregivers and family. I have a number of elderly patients in my practice, a number of folks who can't take care of themselves, either because of advanced age or diabetes, or let's see, you see a lot of arthritis in a lot of folks, younger and older, so they're unable to get down to their feet. It's not that they're practicing poor hygiene or they don't care about their own well-being, it's that it is very difficult for them to take care of their feet. In our elders, a lot of them may be a little ashamed of what their feet look like. So when family members come over to take care of them or to look at them or pay them a visit, they either don't mention that these particular health problems with their feet, or they try to hide their feet from their family members. What I suggest to family members when they visit their elders, or if they're taking care of their elders, to insist on, hey, let me take a look at your feet for a quick minute, just to see how things are developing, how things are doing. If you see some issues with that person that you are concerned about, then set up a podiatry appointment with them. Now, when it comes to caregivers or home health attendants, some of them may not have the training to provide foot care. Some of their certifications or the license may not even allow them to provide foot care beyond just bathing. So, some of the caregivers and some of the home health attendants have kind of taken it on the chin on my channel when it comes to how their clients were allowed to get in this position with their feet. A lot of the time it's because of their restrictions on their job. And so often it's the caregiver or the family member or the home health attendant who will bring the patient to my office so that they can get the proper care. Some folks have asked if I only treat people of color. If you've watched my channel, the vast majority of my patients on the channel have been African American. And I treat folks from all walks of life, all colors, all stripes. But if you're familiar with Washington, D.C., you still know that D.C. population is more African American, about 70% if you look at the statistics. So where my office is located in northern Northwest DC, the neighborhood is highly African American. So most of the patients that come into my office are African American, which is why the majority you'll see on my channel are African American patients. But like I said before, I do treat people from all walks of life, from all stations, from homeless to lawyers and doctors, and I've had a mayor of Washington, D.C. come into my practice, former athletes, you name it. So there is no restriction on who comes to my office or who can come in and participate. We see patients of all ages from 4 months or newborns, and the oldest patient I've ever seen was 104. So fear not, anyone is very welcome in my practice, in my office, and we have an open door policy for anyone who needs foot care. People often make funny jokes on my channel about the smell of feet. How can you do that work? Doesn't that stink? How can you deal with that funk? Yes, it's an occupational hazard in podiatry that we have to deal with smelly feet, but it's not all the time. Most of the time when I'm treating patients, they go into a foot spa, unless the patient chooses not to. The vast majority of my patients go into a foot spa prior to examination and definitely prior to treatment. Going in the foot spa helps soften the corns, calluses, and toenails and makes it easier to remove and more comfortable for the patient. Some folks will ask on the video or put in the comments section of the video, well, why didn't you put the patient in water first? And I did. It's just that it doesn't always end up on video. Sometimes the foot bath part will be edited out just for time's sake, or sometimes the patient may have received the foot spa, the water care, prior to me going into the room and starting the treatment. Everybody gets the foot bath if they choose to. Not all of them end up on camera doing so. Does insurance cover podiatry? In most instances, it does. Medicare covers podiatry. Most Medicaids across the country cover podiatry. Most private insurers cover podiatry. If you're not sure of what your insurance carrier provides as far as foot care, particularly to podiatrists, don't ask your insurer, do they cover foot care? Ask if they cover podiatry, because they may not cover that particular specialty. So you have to call them, ask if they cover podiatry, and then ask what services under podiatry they cover if you need that care before you call your local podiatrist and make an appointment. You don't want to get to the doctor's office only to find out that they can't serve you, or to find out later after the podiatrist has served you and the insurance company won't reimburse that doctor, and now the doctor is sending you a bill. So find out ahead of time what your insurance carrier will cover when it comes to podiatry, not just foot care, podiatry. One of my most commented on videos is about the foot scraper gone wrong. This was a young lady who had gone to a foot salon, or a nail salon is called. And she received treatment at the nail salon and they used the cheese grater type of foot scraper for the thick skin on the bottom of her feet. Subsequently, she developed an infection and severe skin changes. And she came to me to get that situation cleared up. She has 3 videos on my channel for this particular issue, and you can go back to those videos and watch a progression. Again, that series is called Foot Scraper Gone Wrong. Now, are nail salons safe? For the most part, they are. I don't have a problem with them. My family members go to nail salons all the time. What I'll tell folks, like with any health provider or salon provider, whether it be nails, whether it be massage or what have you, you have to be very judicious when you go in there. Make sure, observe that they're practicing sanitary precautions. Make sure they're not reusing things that should be thrown away. Make sure that they are cleaning out the foot spa, the foot bath prior to the next customer. If you're happy with the surroundings, if you're happy with their practices, you get good word of mouth from other people that have gone to this location, then fine. But if not, podiatry is there for you. If you have a specific problem, a recurrent corn, recurrent callus, thick toenails, cracked heels, fungal toenails, the salon is not where you need to go first. You need to seek podiatry and get those situations taken care of, get them in the right road so they can be eradicated, and then you can go back to the nail salon at your leisure for the other cosmetic type things that you're interested in. Okay, so the last thing I'm going to go over before we open up the floor for questions is my most popular video, or video series as it is. And it's the big heel fissure. If you have not seen this video, go back. This particular patient has 5 videos in her series. Now, this patient has developed this issue with both of her heels, but particularly her left heel, to where she ended up with a very thick, callous, dry skin, and it gotten to the point where the skin had broken open and became a wound and would bleed and what have you. Now, this patient has also been treated kind of roughly by some of the commenters, calling her lazy, calling her uncaring, things of that nature. But in her case, that's just not what's going on. She has a neuropathy to her left foot and a drop foot of her left foot because of a back injury and subsequent lower back surgery years ago that have left her with loss of sensation in that left foot and loss of function or the ability to walk correctly in that left foot. So I prescribed a brace for her so that as she walks, the foot is in more of a normal position and it prevents her from tripping and falling. Unfortunately, what this leaves her with is the same type of issues that we see in our diabetics: dry skin, thick skin, scaly, cracked, things of that nature. Because of the issues with her back, she's really unable to take care of herself. Now, I recommended using pumice stones and callus files and things like that, but she really can't do it. It's very difficult for her. So she comes into the office and we get it taken care of on a regular basis. If you go back to that video series, you will see that there is steady progression and improvement in her case. Is it done? Not yet. She's not ready to fly on her own and take care of her feet by herself, but she is making some great improvement. Now, we're going to open up the floor. I'm going to look at the questions and see what we got.
We got some that's on the I've added some to the
Okay.
document. So you want me to say something?
Yeah,
Okay.
go ahead. This is better for you to just call them out.
Okay, so someone wants to know, do you try to choose video clips that will interest us or more challenging cases? How do you choose your videos?
Good question. Who was it that asked that question?
I'm not sure.
Oh.
Keep going.
Okay.
How do you choose your videos?
Well, videos are chosen by what's compelling. Patients who really want to share their experiences with you. I make sure that when patients participate in the channel, that they agree to be participants in the channel, and I always make sure that their privacy is kept. No names, no birth dates, no other identifiers that you'd be able to recognize, such as tattoos, their face, and things like that. Mm-hmm. Videos are chosen by things that are a little bit more unusual from time to time. Your ram's horn, toenail, the big heel fissure, some of the surgeries. But my goal of the channel is not to try to just sensationalize. My goal is to actually educate the public about what a podiatrist is, what a podiatrist does, what are some of the issues that podiatrists encounter, and my approach to dealing with these issues. Some patients may illustrate that issue better than others. So that's how I choose what videos to put on the channel.
Okay. So you ready for your next one?
Yep.
So Latana, I think that's her name.
Okay.
She wants to know, I was wondering, do most of these patients suffer from depression or physical illness and depression?
Latana, thank you for joining. We do deal with patients with all types of medical issues. So what we say in medicine is comorbidities. So we do deal with patients with mental issues. We deal with folks with depression. We deal with folks with organic brain issues. We deal with all kinds of folks who come in, again, diabetes, heart disease, poor circulation, nerve issues, all things that can contribute to their foot issues, whether directly or indirectly leading to the inability of them to care for themselves. So we do see patients in that population. Oh, by the way, my wife is moderating today. My wife, Terry, thank you very much, sweetheart.
Okay. And so this other question is, I have 2 corns on both toes, both on the 4th toe besides the little toe. They're not painful, but they build up, there's a buildup of skin on them. Would you recommend professional removal?
I would always recommend starting with professional removal. Go see a podiatrist. See what is causing the issue with these 2 corns. Okay, so everybody's issue with having a particular problem may vary. So the reason why you have corns on both of your 4 toes may differ from someone else who has corns on the same toe. So your podiatrist will be able to determine what the cause is. The podiatrist will give a good examination, take a good medical history, perhaps take some x-rays to see what's going on with your feet, take care of those corns, shave them down, make them comfortable, give you suggestions to make things more comfortable for you and keep them from coming back.
Okay.
I see Janine Marshall. She's one of our great members, subscribers. She's in the UK. Hey Janine, you said you were going to make it if it wasn't too late out there. But thank you for joining. Good to see you.
Okay.
All right, who's next?
All right. So this other one comes from Fresh Steps Medical Foot and Nail Spa. And she says, hi, Dr. Jefferson. I'm a medical nail tech in Frisco, Texas.
All right.
I get a lot of questions about laser treatment for toenail fungus. What is your opinion?
Okay. So laser treatment for nail fungus is another option, another tool in the toolbox that we have in podiatry to deal with fungal infections. Now, it's important for the public to know that laser treatment for toenail fungus is still, the jury is still out on that. It's not as effective as other treatments that take longer. It's just medications, either orally or topically. There's a bunch of different lasers out there that claim to have success. The success rate is somewhere in the 50s. And laser treatment is not covered by any insurance. So if you want to go this route, one, find someone who has success with it, a patient who has had success with it, and then find out where you can get it at a reasonable cost. Again, it's not covered by any insurance, so it's out-of-pocket expense for the person. Again, seek a podiatrist, get his or her opinion, and go from there. I don't use laser treatment. And the reason why I don't use laser treatment is because the results are not far better than the other options that we have. So to incur that expense in the office and to pass that expense on to the patients, I haven't seen the need to do that as of yet. If they come up with a laser that is fail-proof and it takes care of this issue no matter what the organism is, and it can get to a point where it's cost-effective for my office, it's less costly for the patient, and that's something I would really look into get into. But right now, that's just not the case for me.
Okay. So you have a lot of questions coming in, so I'm just going to screen through them.
Okay.
So Tiny Companions wants to know, is it possible to cure toenail fungus with a patient with autoimmune disease, such as lupus?
Okay, now, autoimmune disease such as lupus, rheumatoid arthritis, and other diseases like that make treating any infection very difficult, whether it be the common cold, an infection from a cut in the finger, but especially fungal infections. Fungal infections take a long time to treat anyway, even a healthy person. When we're treating fungal infections, what we're actually curing when we use medication is the new nail that's coming in. The nail we see today when you come into the office is not the nail that's actually being cleared up. It's the new nail that's growing in its place. So we will trim the old nail every couple of months, observe how the treatment is coming along, and then make adjustments as necessary. In autoimmune diseases, whether it be from the other issues I listed before or whether someone's had chemotherapy for cancer, anything that lowers the immune system is going to make the treatment period take longer. So what we usually take 6 months might take a year or more. So if someone has an autoimmune disease, that doesn't mean that their fungal infection cannot be cleared up. It's just important that the doctor and the patient know that the treatment plan may take longer. You may have to repeat a course of therapy, or you may have to use several things in order to deal with the issue.
Okay. So you have several people asking about how to get into podiatry. They want to study it, why you got in the field, and how can they? Chef McGee is asking, and a couple other people. So want to know more about how to get into it.
Okay. So podiatry, I can only speak about podiatry training in the United States. Podiatry is a medical specialty just like any other medical specialty. You go through high school, you go through college, you take the required prerequisites that you would for any other medical profession. You take the MCAT, the Medical College Admissions Test, and you apply to the podiatry schools. When I came through in the 90s, there were 7 podiatry schools in the United States. There are now 9. I attended the New York College of Podiatric Medicine in Manhattan. When I was an undergrad at Prairie View A&M in the great state of Texas, I was a biology major. I knew that I wanted to go into medicine in some respect. When I was in undergrad, the Health and Human Services had put out a blast that there was going to be a significant shortage of podiatrists in the year 2020, which is where we are now. So the podiatry schools went across the nation scouring for good candidates and increased their enrollment and were giving out scholarships. And I was just one of the lucky ones who was kind of recruited, if you will, by the New York College of Podiatric Medicine. So I finished my undergraduate career, applied, went to New York, got an interview, got accepted, and my life has been better for it. I did my training, my residency training, and my fellowship in advanced foot surgery at the Brooklyn Hospital Center in Brooklyn, New York. And I've been in practice back in D.C., the place of my birth, since '99. I'm 20 years in practice, and I've never looked back. If it's something that you want to get into, an area of medicine, I strongly suggest that you look into it. It is a very fulfilling profession. You're helping people every day. Podiatry is one of the few areas in medicine where someone can come into your office and leave can come to your office with a painful condition and leave pain-free after the one visit, or have the issue really changed after one visit. Not every area of medicine can say that. Don't let your age be a hindrance. The oldest classmate I had when I graduated from podiatry school was 51. He was a former college professor who wanted to change his life and change his career. So he went to podiatry school, and he's now practicing podiatrist just like I am. So look into the different schools, look up the 9 schools, or look up the schools in your country. All the prerequisites, everything you will need to do will be on their websites. You can go from there.
Okay. So you also have some questions about your shea butter. So
Gotcha.
someone once asked first, can you purchase the shea butter mix that you have? And someone asked if they don't like lotion, what do you recommend for moisturizing and to wash your feet and stuff like that?
Okay. So I'll start with the shea butter first. This is our shea butter here. It's prepared from uh, raw natural shea butter, no additives, no preservatives, anything else like that. And we add other essential oils to it to help with moisturize and to help deal with inflammatory issues and help to deal with athlete's foot and things of that nature. So we do sell it locally right now out of the office. We're in the process of developing an online site and distribution and things of that nature, which take a while. But hopefully soon we'll have that available to the general public. Now, for those who don't like lotion or have struggled with finding something that helps them with their dry feet, again, what you need to do is find out what's causing your dry skin. A lot of people will get very frustrated because they've gone to stores and tried this cream, that lotion, that ointment, and they haven't found much success. And that's because these folks have no idea why their skin is dry. Do they have a general dry skin issues such as eczema or something like that? Are they not taking in enough water on a daily basis? Are they in an area of the country where the air is dry, where it's typically cooler? Are your shoes worn out? Are you having a lot of friction in your skin? Do you wear a lot of flip-flops? Do you choose not to wear socks or stockings with your shoes? There's a number of issues that can cause dry skin. And to find something that works for you is to find out what's causing the dry skin issue in the first place. All right, who we got next?
Okay, so we got Sunny 1LB.
Hey, She Wolf, I like that name.
Sunny, okay, and this is Sunny. So, Dr. Jefferson, I'm almost 3 years out post chemo. My nails are pretty fragile as they peel and brittle. Can I expect that the chemo damaged my toenails permanently?
I've seen a lot of patients over the years. Thank you for the question, first of all. And, we prayers and thoughts with you as you go through your treatment. And hopefully that is very successful. And you can go on and continue to be healthy. Chemo, one of the side effects is that it affects nails, hair, and skin. We've all seen pictures of people on chemotherapy who lost all their hair, lost their eyebrows, but it also affects the fingernails and toenails. And it can cause color changes, particularly dark color changes, or it can make the nails thin and brittle, as she explained. And it can make the person more susceptible to fungal infections. So the question she asked is it permanent? It can be. I've seen it be permanent, but most often I've seen it resolve after the chemo has been completed. Usually it's about several months to a year or more before the nails get back to normal. But your podiatrist is the one to go to in this instance to take samples of your nails, send them to the lab, and see if there is a fungal infection present. If not, you'll be in a better position that once the chemos begin to clear from your body, and as that time involved process takes place, you'll find that your toenails will begin to clear up.
Okay. And so Cheryl McNutt wants to know, she said, I've noticed over the videos that you've progressed and the tools that you use. I really like the latest nail grinder you use. What brand is it and what is it called?
Oh, I would have to go back and look at the actual brand of.
Have you gone from the Dremel to the
other? Well, I started with the Dremel. The Dremel drill. We were all podiatrists were trained in the Dremel drill in school, and you can find the Dremel in any hardware store and the bits that go with it. But what I found over time is that the Dremel in some patients can be very irritating, even at low speeds, and that those bits can be a little harsh. So I switched over to a drill made by Osada. Osada is a medical device company that makes surgical drills for medicine and dentistry. So the drill I use now It's used by surgeons and dentists. And the bits I use in them, I get from a podiatry site. And those bits are, one, made for that size drill, and two, they're made specifically for toenails and fingernails for that matter. And so I use different bits, different size, different amount of cutting, or different amounts of smoothness based on the needs of that particular toenail. If the toenail is real thick and real brittle, I'll use a burr that's a little sharper edge, a little rounder, and to help thin that nail out before I need to get to something slimmer and more sleek to get into the areas around the skin and the cuticle. Great question. Thank you very much.
Okay. We also have, do you recommend do you have recommendations for nail fungus over the counter?
Great question. I get that all the time about over-the-counter preparations for toenail fungus. And again, I will always say this. Always get an examination by the podiatrist to see where your toenails stand. The problem with most over-the-counter toenail preparations is that they don't penetrate the actual nail plate very well. Even some of the prescription topical medications are medications you apply directly to the area, whether it be nail, skin, or hair. It's very difficult to penetrate this plate. This plate is made of keratin. Keratin is a protein. Toenails and hair are made of the exact same materials, just a different configuration. That's why nails are much harder than skin. So remember, most nail infections are under the nail, between the nail plate and the underlying skin, what we call the nail bed. So if you're using an over-the-counter preparation and the nails are very thick, hard, and brittle, you're looking for failure. It's not going to penetrate deep enough. It's not going to get to where the fungus lives and where the fungus is thriving, where the fungus is reproducing. So again, see your local podiatrist, get an examination, see how many nails are involved, get those nails tested, see what organisms are causing the issue, and then go from there. If you have one isolated nail and the nail is still normal thickness and it's just maybe some color changes, you can try something over the counter. But again, you have to make sure that you're dealing with a fungal infection. I send a lot of samples out to the lab, and it comes back not to be a fungal infection at all. So you risk, when you use over-the-counter preparations, that you're using the wrong preparation. You may not need an antifungal. You may need urea or something like that to soften the nail up. Thanks again.
Okay, so you have, back to your bed thing, you have several questions from Benicia, Latoya, and Joy, who wants to know about your drill bits. First, they want to know, and then I'll get back to Benicia's questions later, but they want to know about the drill bit affecting your lungs. And then how did you come up with the Q-tip? Did you come up with this Q-tip drill bit? And they really like that, the one that cleans between the toes. So tell us about that. And well, can you sterilize them?
Yes.
As well? Okay.
First of all, thank you all for looking out for my health. Those who've commented, I get a lot of comments about the nail dust. And I do wear a mask when I'm performing that procedure. I switched from using a vacuum, if you've noticed, if you watch the channel long enough, to using water. Water suppresses the nail dust, captures those particles, and keeps the vast majority of it on the nail and on the skin. There's some particulate matter, sure. That's why I do wear the mask, so I keep myself good and healthy. The nail bits, they are made of stainless steel, therefore they are autoclavable, which means after use they go into a liquid disinfectant, and at the end of the day, we autoclave them to kill everything. We kill fungus, we kill bacteria, we kill viruses. So that's our process about making sure we keep things nice and sanitary. Did I miss another part of her question?
And about the Q-tips.
Oh, yeah. So I was looking for a way to buff the nails and to clean between the nails and do so it's very comfortable for the patient. Yeah, there are nail buffers that can be bought, but it's pretty doggone expensive to buy a whole bunch of those because because they're soft material, you use them once and throw them away. So I noticed that the stem of Q-tips fit perfectly into my drill. So I cut the very end of the stem or the shaft rather of the cotton swab, and it goes right into the drill, locks in place perfectly. It doesn't do what we call helicopter or go wild, and so I'm able to buff the nails, clean between the toes and other areas of the feet, clean the areas around the nails, the cuticles and what have you. It's perfectly comfortable for a patient, even at the highest speed of the drill. So yeah, I just came up with that on the fly, and it's working out great. All right, what we got next?
Um,
Swana Yvette, thank you for very much. Thank you for your super chat.
okay.
Looking forward to more comments from you, Twana.
Okay. We have several. This Benicia, she also asked. She said she had a bunion surgery on each foot. Right foot done by an ortho, and the left foot was done by a podiatrist. Right foot is now turning out to be a hallux virus, and the foot doctor can't help much. So what should she do?
Okay. So the training for bunion surgery and foot surgery in general between a orthopedic foot specialist and a podiatrist is pretty much the same. Now, every doctor has his or her own approach to bunion surgery, and that approach is tailored to the particular problem. No two bunions are alike. No two patients are alike. So the doctor will approach that bunion in different ways. That particular doctor will use hardware and other tools that are comfortable in his or her hands. Now, you say you're now suffering in your right foot from hallux varus. What hallux varus is, it occurs either after a bunion surgery or due to arthritis or due to injury, to where the big toe is now too far over toward the midline of your body. Instead of being here or closer to the second toe, now it's more offline. It's hanging more closer to the opposite foot. That can be a outcome of what we call overcorrection of the bunion. The metatarsal is shifted over to narrow the angle between it and the second metatarsal with the aim of straightening the big toe. Now, if there's too much aggression in moving that metatarsal over, even if it's slightly, now the big toe can actually fall off to the side. And that sounds like what you're dealing with in your right foot. Can it be corrected? Actually, yes, it can. So what you should do in this instance is to find a surgeon that has experience and feels comfortable with doing corrective surgery. Corrective surgery is when you go back and fix a previous surgical issue, kind of like they do on the show Botched or something like that. The doctor feels comfortable doing that, then hallux varus can definitely be repaired. It may require more surgery if you're up for that, but it's definitely a problem. And I've fixed hallux varus surgeries before, and it can be done. Thank you.
Okay, so we have any other questions? Someone wants to know about your music. Why, and here's from Grace Smith. She asked, why do some doctors remove granuloma tissue following an ingrown removal and some do not?
Okay, great question. Ingrown toenails, one of the side effects is what's called a granuloma. What a granuloma is by strict medical terminology, is a tumor. It's benign, it's not harmful in any way, but what occurs is as the ingrown nail continues to irritate the skin, the response in that particular area is to form an overgrowth of blood vessels, an encapsulated overgrowth of blood vessels. And that's what a granuloma is. The why it's a problem is that very little effort or very little pressure or very little touch can make it bleed. And so most podiatrists, I do every time I see a granuloma, I remove it. Every time because of that issue. And if you have bleeding, you have a higher chance of infection and discomfort. So I always remove the granuloma when I'm dealing with ingrown toenails. I've seen granulomas in other areas of the foot after a puncture wound or other types of injuries. But most of the time when we see it in podiatry is because of an ingrown toenail and it's chronic irritation of the skin forming the granuloma. So yeah, every time I see it, I remove it. Why doctors would choose not to remove it, I have no idea. I can't speak for them or their approach. But my approach is to always remove a granuloma.
Okay. Someone wants to know, why did you start your YouTube channel?
Well, good question. I actually started the YouTube channel about 3 years ago. I wasn't really versed on how to really work it, but I used it to give, to show my patients and the public things what I'm trying to do, used it for marketing and what have you. And then after a little while, I just let it go. I didn't really understand how to work it. I really wasn't a YouTuber as much. But my wife is much more versed in YouTube and everything YouTube than I am. And so a year ago, going back to actually this month, February, is really when I began working with her and into building this channel. And the purpose of it is to, number one, educate the public on what we do as podiatrists. A lot of people have no idea what a podiatrist is, what a podiatrist does, what a podiatrist's background and training is. So this was my way to jump into the fray. And as I'm sure most of you know, there are podiatry channels all over YouTube from all around the world. But I wanted to give the world my spin on why I do what I do, the type of patients that I see, my approach to things. And because of you, the viewers, because of the patients, the channel's grown leaps and bounds over what I expect it to be. And in such a short period of time, it's really very surprising and actually very encouraging. So I want to, again, thank you for watching, participating, commenting, and helping this channel grow and helping to spread the word about good foot health. And we're going to keep this thing going. Thank you.
Okay, and any other closing comments that you may
Water
have?
real quick.
Any other closing comments that you may have? We have, it's a lot of questions, but I know we're running out of time.
Let me see. Let me see if I'm going to look through here. See.
Okay, here's one.
Right. Okay, I got a good one. Carrie Connor. What can I do to prevent my 9-year-old son from getting ingrown toenails every time I trim them? They get sore in the corners. Thank you very much, Carrie. Most ingrown toenail patients I see in my practice are actually from children, particularly in the age group of your son. Yeah, on occasion we'll see them in adults, but most of the time we see them in kids. And the reason most of the time we see them in kids is because of improper trimming of the toenails, either by the kid, him or herself, or by the parent. So what happens is, as the nail is being trimmed, either by the child or by the parent, they take just a regular nail nipper or a regular toenail clipper, and they cut around, and they often cut too short, or they try to go into the corners and trim out that last little part there in the corner of the nail. What invariably happens is that there's more nail under the fold of skin here. And so what occurs is that a little spike of nail is left under the skin that cannot be seen. So as the nail continues to grow out, that little spike of the skin that's buried, spike of the nail rather, that's buried under the skin causes chronic irritation, a break in the skin, and that's when you can get your infected ingrown toenail, your associated granuloma, the pain, and everything else associated with it. So if this is a chronic recurring issue with your son or anyone else's child out there, Yes, again, I preach from the mountaintop. Go take your child to a podiatrist. See what's going on. Oftentimes, what happens because of the chronic irritation, you get chronic swelling in this area of the nail fold. And so, as the nail continues to grow out, there's no way for that nail to clear the end of the toe because it continues to dig into that corner of skin. So, your podiatrist will be able to deal with that issue to prevent it from coming back. Whether a procedure needs to be done here where the nail begins to grow to prevent the nail from growing back in that corner, or if something needs to be done about the skin, if it's overgrown, thick, and scarred, then that needs to be addressed. But at 9 years old, you definitely want to see a podiatrist as soon as possible to be on the right road to get that taken care of because you do not want this issue to continue much longer, especially into his teen years. Thank you.
Okay. And I think maybe a last question, if you have 24 minutes for more.
All right, come on.
Okay. There's several. Um, Cynthia Rather asked, I have naturally thick toenails. Is there anything I can do at home between pedicures to help control that?
Okay. I also want to send a shout out to Latoya Foster for her super chat. Thank you very much. Naturally thick toenails. Naturally thick is kind of in the eye of the beholder. There are various levels of what we consider to be normal thickness in a toenail. Some folks toenails are naturally thin. Some folks are naturally thick. Some folks are naturally normal. What does that all mean? It depends on who you go to. Now, if you have a particular thickness that's chronic and you've never seen anybody to really evaluate what's causing it, then you need to see a podiatrist about that. Thickness of the nails is caused by a number of issues. Yes, toenail fungus is one of the issues that we see that cause thickness of the nails most often. But nail thickness can also be caused by circulatory issues. Nail thickness can also be caused by old trauma to the foot, even if it was very minor at the time. Thickness of the nails can come from what we call repetitive micro trauma to the nails over the years wearing shoes. When we wear shoes, our feet slide back and forth inside the shoes, side to side as we go through our day and walk around. So if your nails are constantly banging the inside of your shoes, even though it may not be uncomfortable for you, that also can be contributing to your thick toenails. So again, before recommending a treatment for it, you need to find out what's causing it in the first place. There's a lot of things that you can use for toenails. There's a lot of things in the drugstore they sell for nails, whether it be urea preparations or other type of preparations for thinning out toenails. But you can do that, you can spend a lot of money, and you can get frustrated over not getting any results because you really don't know what's causing it. Whenever you're dealing with a toenail issue, whether it be a fungal issue or thick nails, like in this case, you have to be, one, diligent on the medication that you're using. Two, you have to be very patient. Nails are slow growing. They're constant, but they're slow growing. And the average adult with good circulation and no other health issues, for the big toenail, it may take about 4 to 6 months to completely replace itself. So if you're using a preparation, either over the counter or prescription, you've only used it for a couple of months and you're not seeing the changes that you want to see, and then you take that medication and you toss it, that means you've only been through about a third of the way of treatment. So you got to find out what the cause is so that the correct preparation can be recommended or prescribed for you.
Okay. All right. So all the other questions you can probably ask later.
Yeah. So again, thank you all for joining me this afternoon. If I didn't get to your question in today's Q&A, I will answer them in the replay. You can go back to the replay on later today or tomorrow, and I will answer those questions. We will be doing this again. This was a lot of fun. Again, thank you for supporting the channel. Thank you for your comments, your questions. Thank you for the super chats. Thank you for supporting this channel, for helping it grow, for spreading the word about good foot health. It all starts with the feet. The first thing to get out of bed in the morning are your feet. The last thing to go to bed at night are your feet. Nothing works harder on your body than your feet, than your heart. So, for those who are having issues with treating your own feet, figure out why that is. And the best way to figure it out is to see if you can touch your toes. If you can get down and touch your toes, then you should be able to render some kind of foot care, or at least some type of observation of what's going on. And if you cannot do that, then you need to definitely seek professional care. So, again, thank you very much. We'll be doing this again soon. And like I say at the end of all my videos, take care of your feet. Dr. Jeff, DC Foot Doctor, out.